breast lift or a mastopexy operation is a surgical procedure on the female breast which tries to reverse the aging process by lifting the breast or returning the breast to its original position, usually higher up on the chest wall. Any patient who has developed droopy breasts, either through aging or after childbirth, are usually very good candidates for breast lift procedures. There's a wide range of mastopexy or breast lift procedures, and it really depends on the volume of breast tissue that the patient has, how droopy or ptotic the breasts have become, and whether the patients wish to reduce the volume of their breasts or in fact increase the volume of their breasts by combining it with an augmentation. The incisions that we use for mastopexy depend on the type of mastopexy that we undertake. The first is described as a circum or periareolar incision, and this is in fact a scar that simply goes around the areola of the breast, leaving a virtually invisible scar at the junction of the normal skin and the pigmented areolar skin. If more skin needs to be taken out and the breast needs to be lifted further, then we normally have to put a scar on the breast which runs up and down between the areola and the chest wall below. This scar is sometimes rucked up or rouged to begin with, which leaves a bumpy scar that usually settles out over the first 6 to 9 months. If the breasts are very droopy and you're aiming to move the breasts a significant distance up the chest wall, then the scar that may need to be used is an inverted T or an anchor-shaped scar, again with the scar running around the areola, down the breast to the chest wall and then across the chest wall. Mastopexies can really take anywhere between 1 and 3 hours depending on how much work is needed on the breast and how much the incisions that are used, how much skin might need to be removed, and the suture techniques that it involves. For the smaller mastopexies, these can usually be completed on an outpatient basis with day case surgery. For the larger mastopexies that may require a surgical drain afterwards, I do like to keep the patients in hospital for observation overnight. I'm often asked whether mastopexy or breast lift is a painful procedure, and in general we find that it isn't. Although everybody's pain threshold and tolerance is very different, the operation is essentially on the skin, which is a bit sore, and the gland of the breast, which usually doesn't produce significant pain. The recovery time for a mastopexy is again variable, and we're really guided by how much work is done on the breast in terms of tissue movement or resection or plication. But in general, I would recommend patients look to take 3 or 4 weeks off afterwards and avoid strenuous exercise for this period. The risks to surgery are those of any operation, such as infection, bleeding and scarring. And in the case of a mastopexy, one of the most significant problems is wound healing. This problem is increased, especially in smokers, so we would encourage everyone to stop smoking and would prefer them to have stopped probably for a period of 4 to 6 weeks. The other significant changes that can happen in the breast are to do with the nerve supply, which gives feeling to the nipple. And when we're lifting or moving the breast mound back on the chest wall, sometimes those nerves can be stretched, damaged or cut, which can result in loss of feeling in the nipple. And that's something that the patients must understand and accept before going forward and consenting to this operation. The initial results of mastopexy are usually very good and patients are very happy. But we must never forget that gravity is always acting on us, and over time gravity will act on the repositioned breast. And depending on the skin envelope, that is how elastic your skin is, and also on the weight of the breast, then it may be that over the coming years the breast starts to droop again.